The real problem: silent offenders disrupted your gut microbiota and its microbiome. And I'm going to talk about what these silent offenders are later. But for now, as an educator, I think it's important to define our terms. This way, we are on the same page and you can appreciate the steps that we will take in our program to improve your gut health. So, two words that you have probably come across a lot during your search for help: the microbiota and the microbiome. Because once you understand what these are and the big role they play in our health, you will be armed with the knowledge and the tools you need to restore your digestion and, by extension, your health. The microbiota refers to all the organisms, the little microorganisms that reside on and inside our bodies. These organisms are in our mouth, skin, lungs, vagina, bladder, and of course in our gut. The famous scientist Dr. Velio Bocci in 1992 called the microbiota the neglected human organ. That's right, the neglected human organ. And later in 1998, Dr. Michael Gresham called it the second brain. That's right, the second brain. That's how important the microbiota is in our lives and for our health. Think of the microbiota the same way we think of a given population's demographics. For example, a city like London or New York would have a diversity of ethnic groups like Africans, African Americans, folks from India, Caucasians, Asians, Hispanics, and so on. These are all human, but of different ethnic backgrounds and cultures. That's how our microbiota is, a wide range of different microorganisms, and include bacteria, viruses, fungi, archaea, and so on. Now let's define the microbiome. The microbiome refers to the characteristics of each individual organism, their own personality, and the environment in which they live, that is, the environment of our gut. Same way we think of social interaction between humans in a given demographics and their environment. Folks that live in an impoverished neighborhood or underserved communities live in a different environment than those who live in a more affluent area. That does not make one group of people better than the other. But our environment does affect our behavior, our physical and mental health. That's the same way it is within our guts. The relationship between the various species of the microbiota, the chemical environment within the gut. Is there enough acid in the stomach to break down food? Are there sufficient enzymes from the pancreas for digestion? Is there enough bile from the gallbladder? Is there enough movement or peristalsis in the gut to clear undigested food? All of these factors play a role and contribute to an either healthy gut environment or one that leads to digestive problems. This is what we are speaking about when we talk about the microbiome and much more. We are talking about their genes. We have in our gut more bacteria genes than all human genes put together. About 99% of the genes in our bodies belong to bacteria, and only about 1% are human genes. Interestingly, today we have so many bacteria that have become resistant to antibiotics. The genes from this bacteria can be transferred to other bacteria through a process called horizontal transfer. They don't even have to touch each other for such a transfer, and makes the other bacteria, the recipient of the gene, antibiotic resistant. That in itself is part of what makes the microbiome. The enzymes that they release to break down food. Some of these enzymes have an effect on our bodies, like beta-glucuronidase, an enzyme that some bacteria release that can affect the levels of estrogen and possibly be responsible for cases of estrogen dominance in some women. You see, we often think that digestive problems are the only result of an imbalance in our microbiome. But in fact, there are people who have an imbalance in their intestinal bacteria who may not be displaying any digestive problems. Remember earlier I asked you if you wonder why some people can eat whatever they want and not have the same symptoms that you may be experiencing. Well, their symptoms may be more neurological in nature, or mood disorders, or cardiac complications, or skin issues, all having their origin in the gut. So symptoms of dysbiosis and imbalance of the bacteria in the gut is not just expressed in poor digestion. They can include more systemic or body-wide problems. The byproduct of digestion from this bacteria. You see, it is important that bacteria ferment fibers that we cannot digest. This fermentation eventually leads to the production of short-chain fatty acids, and for now, suffice it to say that these are very important for our health. So we need bacteria to do its job. However, some of the products of this fermentation are hydrogen, carbon dioxide, and methane gas, all of which in excess can lead to constipation, diarrhea, or both. These gases can also lead to pain from bloating. Like when you blow air into a balloon and it keeps getting bigger and bigger, the bloating then affects nerve endings in our guts that leads to the pain associated with bloating. You see, we are a long tube of around 30 feet in length, with a body built around this long tube. Starts in the mouth and ends, well, you know where. And inside that tube, our intestines, there is an entire bacterial ecosystem. And part of what makes the microbiome is the interaction with each other and with us, the host. And as long as they coexist in harmony with each other, and we provide the nutrients they need to survive, and keep pathogenic bacteria out of the intestines, we have optimal digestion and good health. So that's what we're talking about when we speak of the microbiome, the interaction between the various species of the microbiota and their effects on our health. But this ecosystem can be altered, disrupted, and that's the real problem. As I said above, the real problem is that silent offenders have disrupted our microbiome. The symbiotic, mutually beneficial relationship between the various species and with us, who are the hosts, has been disrupted. And please bear with me, because understanding this topic of the microbiome is key to appreciating the three simple but yet profound steps that I will be sharing with you shortly, so that you too can be free of digestive afflictions. So again, silent offenders disrupted your gut microbiome. And here's why I say that. You see, by now you understand that our microbiome is a complex and delicate ecosystem within our bodies, consisting of trillions of microorganisms, including both good and bad bacteria. These microorganisms massively influence our health and affect everything from digestion and immune function to mental health and chronic disease prevention. Therefore, maintaining an optimal balance of our intestinal microbiome is essential for overall health and well-being. But when silent offenders wreak havoc in the gut, it leads to many of the symptoms associated with digestive disorders, such as bloating, pain, acid reflux, constipation, or diarrhea, and in some cases, both. We covered this earlier when we spoke of bacteria production of hydrogen and methane gas that can lead to constipation or diarrhea. Some of these silent offenders can come by way of the use of antibiotics, or even the excess use of natural antimicrobials. Sometimes I hear patients say that they take echinacea every day, or golden seal, or berberine. That's fine. However, remember the old saying, the dose makes the poison. In other words, any chemical, even water and oxygen, can be toxic if too much is ingested or absorbed in the body, and they will eventually affect the microbiome. These natural antimicrobials, if overused, can be just as detrimental as chronic use of antibiotics. Other silent offenders include unnoticed infections from our last vacation, prolonged stress. Now that's a big one. Stress will certainly wreak havoc on the microbiome. And it is the reason why the optimal digestion blueprint includes stress management techniques in an effort to keep us in a parasympathetic state, that rest and digest and procreate state opposite to the sympathetic mode or fight or flight, stress. Silent offenders often overlook our extreme diets, and we will talk more about that later. And if these silent offenders continue to disrupt our microbiome and become chronic, the intestinal wall gets damaged. It will eventually damage the lining of the intestines. The cells in the intestines that separate us from the outside world. Remember, the intestinal tract is outside of our body. It is open to the outside. It's a tube. The heart, the liver, the kidneys, and all other organs are inside of us. So when the wall between us, the cells in our intestines, and the outside becomes damaged, they will allow undigested particles to enter into the bloodstream. This is what is commonly addressed as a leaky gut, or intestinal permeability in medical jargon, which then leads to inflammation. When this happens, where food and waste products from bacteria enter into the circulation, the immune system recognizes these particles as threats or pathogens. The immune system does not know that it is a harmless piece of garbanzo or pinto bean. It just knows that whatever that is not self, and thus an outsider and does not belong in the circulation, and activates an inflammatory response to fight them and remove them from the circulation. This reaction from the immune system is not necessarily a bad thing. We need the immune system to react, and acute inflammation is part of that process. The ancient physicians described the 4 cardinal signs of inflammation as redness, or rubor, heat, calor, swelling, tumor, and pain, dolor. Now, you may not be experiencing these 4 cardinal signs of inflammation directly on your abdomen, but the redness may be seen in the face, like with acne or rosacea. The heat may be from fevers or the heat from the blood when it rushes into an infected area, as well as the swelling on boils or edema in the joints, and of course, pain. But all of this is an appropriate response from the immune system. The problem arises when this becomes chronic. Unlike acute inflammation, which, as we said earlier, is a normal and necessary response to injury or infection, chronic inflammation lingers and can lead to long-term damage to tissues and organs. And research suggests that chronic inflammation can lead to autoimmune disorders. Of course, when someone is in pain and in discomfort, they may like to use over-the-counter NSAIDs, non-steroidal anti-inflammatory drugs, or corticosteroids. And we know the detrimental effect from long-term use of these remedies, but I get it. You've got to do what you've got to do. But the real culprit is not the inflammation. It's the dysbiosis, the imbalance in the microbiome, and that's what the optimal digestion blueprint aims to restore. And the sooner we address it, the better off we are. The good news is that I've figured out a simple way to solve this problem, and that's what I'll be sharing with you in this training, in this masterclass. But first, let's take a closer look at how you can reduce the inflammation in your intestines, restore bacterial balance, and get rid of your digestive issues once and for all. The key to your success lies inside these 3 boxes. A proven 3-step system that will help you go from persistent bloating and abdominal pain to enjoying your favorite foods and feeling comfortable in your own skin and clothes, of course. Here's a small taste of what it has already done for others just like you. This is Linda. Linda, who went from 4 years of bloating, abdominal pain, chronic constipation, and foul-smelling stool, to drastically improving her digestion to the point that bloating, constipation, and other digestive problems resolved by following the 3 steps of the optimal digestion blueprint. You will hear more about her in a bit. You'll also see how this helped Carol. Carol, who went from experiencing digestive problems as a child from use of antibiotics for ear infections, and then in high school, antibiotics for facial blemishes, and through college, to managing her digestive issues and getting her life back as an adult. So proud of her. She did the work and it paid off. And I'll share a few more stories with you as we go along. But just like Carol and Linda and many others in similar situations who made the choice to go from suffering with digestive problems to a life free of pain, bloating, and irregularity, you too can go from where you are now to this, to eliminating bloating and pain, being free from that, to better absorption of nutrients and optimal digestion due to a healthier gut. No embarrassment moments when socializing or eating out. The best part? You don't have to guess anymore what to eat or what to take. Why? Because through the optimal digestion blueprint, you will gain the knowledge on how to live in harmony with your gut. And in turn, the gut will respond by giving you radiant health. You won't need to rely on just eating more fiber. Fiber is important, but the right fiber is what makes the difference. Some types of fiber are better if your gut is producing more hydrogen. On the other hand, other types of fiber are better if your gut is producing more methane gas. How would you know? Well, I'll show you in just a bit. This program has worked even when women have tried everything else and nothing has had lasting results. And why this works? Well, we test. We don't guess. You see, we are where we are now because we guess too many times. Well, I guess I need to eat more fiber. Well, I guess I need to eat more frequently. Well, I guess I need to take probiotics. And one of my favorite quotes from the great American playwright and screenwriter, Tennessee Williams, guessing isn't knowing. And if you're still watching, it's because you want to know and you are tired of guessing. So even though having digestive problems hasn't really been your fault, it is your responsibility to do something about it. And that's why you're here. You see, when it comes to digestive system problems, there is no magic bullet. There is no panacea, something that cures everything. No one size fits all. Because like our fingerprints and teeth, which are unique to each one of us, so is our digestive tract. So I want to commend you for still being here and wanting to know how to remedy your digestive complaints. You are demonstrating that you are the type of person who's willing to take control and do what's needed to finally see results. And stop guessing and trying to this and trying that. Now, before we go any further, you may be wondering why you should even listen to what I have to say. So let me quickly give you a short background so that you can see that I really understand where you're coming from. You see, I'm not just a creator of this program, I'm also a client.